Seth Akweshie has been very active in the SADC region. He has been working on building a regional a regional strategy for SADC on the pharmaceutical sector, and he's now back in the private sector. But I'd really like him to share with us in a few minutes his experience on developing this regional strategy, and what are some of the insights that you have learned, Seth, that you want to share with us about the SADC regional pharmaceutical strategy and its implementation?
Thank you, Prof, for the introduction and the opportunity for me to share my insights with this august group of stakeholders on this topical issue at these critical and challenging times. And I want to thank all the other speakers, from Dr. Akebe all the way down to Caroline. We were asked, I was one of a team of experts who were asked to assist the SADC region to develop a regional industrialization strategy. But before then, I was supervising a group of a team from Belgium who developed a strategy for regional manufacturing of pharmaceutical products. The vision of the regional pharmaceutical manufacturing industry in SADC is to contribute to universal health coverage by supplying affordable, good quality, essential medicines and health commodities for both communicable and non-communicable diseases. Now, the vision has a dual purpose. One, to develop a sustainable regional pharmaceutical industry that is competitive, reliable, innovative, productive, and responsible, and to promote health for all people in the SADC region through the universal health coverage and improved access to medicines. The overall goal of the strategy was to manufacture in SADC and make available these medicines, affordable, quality, efficacious medicines that are essential medicines to the region. Now, most of the challenges that we identified have already been alluded to by the previous speakers. Issues that have to do with quality and standards, the limited range of pharmaceutical production, weak regulatory framework which allows counterfeit drugs to enter the region, limited research, development and innovation capacity, inadequate skills, poor backward linkages, and lack of policy space for manufacturing pharmaceutical products. And that is due to intellectual property restrictions, as Caroline has just spoken to. Now, we also have a limited number of women involved in sciences and therefore in the pharmaceutical sector. So the strategy sought to address these weaknesses. So the interventions that we recommended had to do with developing the infrastructure for the pharmaceutical industry, to put in place a strong accreditation and quality control systems in the region, to also promote research, development and innovation, including the use of local materials, to promote the production of medical equipment. And it is great to hear Marlon mention that this is being done in South Africa, but one would expect it to move across the region, then and across the continent. Then we also need to exploit the thrift flexibilities for producing essential generic medicines and health commodities. I think this is in line with what Caroline just said, and Dr. Skumbuzo mentioned it earlier on. And we also need to promote female scientific education to improve their specialization in pharmaceutical skills. Other issues that were mentioned includes the IPRs, and we also have to ensure that the regulatory framework is important, like I mentioned earlier. But then we were asked to develop a specific strategy for the pharmaceutical manufacturing sector with emphasis on HIV and AIDS, TB, and malaria. But having developed that system, it is also possible to use it to regionally manufacture affordable generic medicines for treating hepatitis C and non-communicable diseases such as cancer, diabetes, and cardiovascular diseases, which are already on the increase in Africa. Now, we then looked at 4 areas that need for us to focus on. One of the areas is policy alignment. And I think that has been mentioned, but in this particular case, we are looking at aligning the policies on health, on trade, on industry, on finance, on agriculture, and I must add, on education. It's very important because there are interdependencies between these sectors of the economy. Then the other issue is the issue of resource mobilization, human resource, finance, infrastructure, etc. The regulatory framework was also looked at, and there we have IP, and we talked about harmonizing the regulations. Then the final area of focus is that of collaboration and partnership and knowledge exchange. I think this is one area that we need to do very, very well under the AfCFTA arrangement. So having looked at all that, the idea is to come up with an action plan that will include pool procurement, which was mentioned earlier, and they should be linked with the AU's Africa Medical Supplies platform. Then we need to look at the quality aspects, get WHO certifications, and so on, look at the human resource component. One of the recommendations was also to ensure that we have centers of excellence and that we have academia industry linkages as well. Member states are also supposed to undertake specific areas like including the TRIPS feasibilities in the national legislation, and also to ensure that national medical regulatory authorities exchange information from time to time. Now, a strong emphasis was put on the critical role of the private sector as investors, because more often than not, the private sector is not recognized as the real investors when it comes to production. So the private sector will do the investment, and they will need to collaborate with the public sector and other businesses from other regions in Africa, in Europe, in the US, in India, that was just mentioned, in China, etc. But civil society also has a very important role to play in implementing and monitoring the effectiveness of the strategy on the ground. Now, I need to emphasize here that the pharmaceuticals value chain is a cross-cutting value chain with potential for catalyzing Pan-African industrialization by leveraging Africa's natural resource endowments to anchor sustainable growth of pharmacy and other economic sectors. And therefore, there will be immense contribution by developing this sector to save on foreign exchange, to create employment, as has been mentioned earlier, and to reduce poverty across the board, especially among women and the youth, and ensure better quality of life. In implementing, one of the big problems that we have, and the major challenge, is a slow start. And therefore, we need to accelerate our implementation of these strategies. With this particular one, having been developed with financing from the African Development Bank, the European Union provided some funding under EDF 11, and GIZ is currently implementing. I need to emphasize that there is a lot to be gained from the developing the pharmaceutical sector, but that has to be linked with other sectors in our economy, because not every country has the resources to manufacture pharmaceuticals, but all countries are in the value chain, the pharmaceutical value chain. We either consume, or we provide raw materials, or we manufacture, or we distribute, one way or the other. Therefore, when we want to talk about the African Continental Free Trade Area Agreement, we need to be a bit wide in terms of scope, and therefore we need to improve our productive capacity, which are the supply side constraints, not just for pharmaceuticals, but for other sectors as well. I will mention just a few of them. We are all aware of our energy and infrastructure deficit, without which we cannot industrialize, we cannot produce anything, and therefore we cannot trade. We also have a huge financing gap, which we are all aware of, and some of the questions that I'm seeing in the chat is about FDI, foreign direct investment. But we also have to take a good look at domestic investment in order to complement each other. Now, one area that we have not paid much attention to is the agricultural sector, which constrains industrial production and competitiveness due to the inadequate and irregular raw material supply. Now, this constraint also limits our ability to grow the manufacturing sector based on agro products and agro value chain development. I also need to emphasize that we have weak institutions with limited capacity to provide support, especially to the small, medium, and micro enterprises, including the informal sector. So we need to look at that. Mention has already been made about industrial capacities and capabilities and industrial infrastructure, like industrial zones. We need to also have that in place. Now, then we need to upgrade and modernize our industries as a whole. Then one issue that will confront us as we implement the AfCFTA is this whole issue of non-tariff barriers, especially against products from other African countries. One of the agreements now is that about 90% of the non-tariff barriers should be removed. I hope that is done very, very quickly. But there are also demand-side constraints because of the low purchasing power of the general population. But this is where the government also should come in, like Dr. Skumbuzo mentioned. There is low aggregate demand from the public sector, and that support will be needed. We also need to ensure that we have technology transfer to support our efforts at regional value chain development. We need to also align national policies with the regional policies that are developed. Now, in value chain development, we need to think globally while acting locally for job creation and poverty reduction. We therefore need to also ensure that our small and medium enterprises link up and supply inputs to large-scale enterprises. We need to ensure that there are public-private partnerships, as have already been mentioned, and to ensure that we have effective production facilities. Now, let me conclude by saying that after all is done, we need to define measurable indicators to enable us in Africa to monitor our performances, to monitor our share and structure of world trade. Now, examples could be the share of manufactured goods in our total trade, the share of industrial products in both national and continental GDP, the contribution of industry to employment and the share of industry in the global competitiveness index. Thank you, Prof, and thank you to all the panelists for making my work easy at the end. I would want to leave us all with this statement. Public health is actually a human rights issue. COVID has made that very clear to us. And so when it comes to addressing issues regarding public health, our leaders will need to ensure that the resources required are made available. That is the first one. And that we move very quickly with implementation. Most of the time we develop these strategies and then we sit with them saying there is no money. But it's a question of prioritization. Then also, in some of our countries, we impose duties on raw materials and excipients for manufacturing in our countries. And yet the finished products come in duty-free. It is high time we remove those duties, which are taxes, and rather let the companies grow, and then we can tax them on their profits at the end of the day. I would also want to emphasize that the pharmaceutical sector works on economies of scale. And so there is need for mutual recognition across our continent. And yes, one cannot talk too much about the need to have active pharmaceutical ingredient plants in Africa. In fact, we need more than 4, in my opinion, because these inputs contribute, the APIs constitute about 75% of the cost of manufacturing the finished product. So if we want to develop this and trade among ourselves, we have got to get the plant here. I think I agree very much with what the previous speakers have said. We need to develop our productive capacity in all areas and recognize the linkages that exist. Thank you very much to Mabel and all of you for organizing this fantastic webinar, and we will continue with the discussions from here on. Thank you.